hi everybody. Welcome here. And guys, today is my first live stream in like a month's time. And guys, I am so happy to be here. I'm so happy to be here. And today's live is going to be a different kind of live stream. Like we're going to be having a guest. Yeah. So while we wait for our guest to arrive, I would like to I'd like to do what? I'd like to share this live stream. And hold on a bit. Hi guys. I'm already seeing someone here, and I'm so excited to see you here. I'm seeing more people coming in. I'm so excited to see you guys, and we are waiting for our guests. Yeah. And this person is not new to YouTube. This person has always been on YouTube. And so the problem is that the person hasn't yet called in, but they are yet to come in. But I'm so excited to see you guys tune in right now. Yeah, because this was like an abrupt live stream, though it was like on my menu. Just that it was supposed to happen sometime, and then um hold on guys. So, like I was saying, this live stream was supposed to happen, but I wasn't sure that it was going to happen this weekend because I've been so tied up with work. Like, because I've told you guys before, I don't only do YouTube, like I do. Hold on, guys. Let me try and adjust. Guys, hold on. Let me just get myself a bit elevated because I feel like I'm so low. So hold on. Okay, this is much better. So, guys, like I was saying earlier on, so I didn't know that it was going to be today. So I planned, and here we are. Guys, I'm so happy to see you here, and um, I'm hoping you guys can hear me. So I have just got a message from my guest, your guest, yeah. The person is going to be showing up in about 25 minutes time. I think he's gotten an emergency or something, but he's going to be coming on. But I'm so sure that if you actually um if you saw from our community tab, you definitely know who is coming here on our channel. We're bringing a professional to my channel, yeah, and you guys should go check out his channel. I'm not going to announce the person until they come. But while we're here, please do tell me if you can hear me. Okay, please do tell me if you can hear me because I don't want to be talking and all of a sudden it just looks like I'm talking to myself. So, please do tell me if you can hear me, and so we are able to like proceed. Hey, Wambu Abraham, how are you doing? How are you doing? I'm so happy to see you here. Yeah, I'm so happy to see you here. And welcome. Thank you for tuning in. Okay, that is great that you guys can hear me. Oh my goodness, so many people are like coming in. So many people are like coming in, guys. Welcome to this live stream. So like I already said, um basically our guest is yet to come. It's going to be arriving, I think, in 23 minutes. Yeah, I'm here. and I think because he got a an emergency. But this live stream, in case you weren't able to read the what's that the thumbnail very well. So this live stream is basically okay. Before I even talk about the live stream itself, I started a campaign against a certain health condition that I happen to suffer from, and that campaign is called venous insufficiency. Yeah, it has different levels. There's when it's just developing, there's when it is severe, and yeah, and it's really not nice. So because I started that campaign, the first video that I ever produced about it, I think the first video was an interview. No, I think the first video was when I was really, really fed up of people asking me and every single thing. So I decided to put up a video about it. It was basically a story. I didn't even expect it to be that long, but you can always try. You can always go back and watch that video just to know what I'm talking about. Then I had an interview about it, and then I just quit it like that. So sometime um recently, I was like, let me just launch something like a campaign whereby I have several videos talking about this thing and letting people know that okay, this thing is real. People should check out for their health. Beyond that, people should not like make people who have this condition feel bad. They should not look at people like they are weird or out of this world, that kind of thing. So because of that, I had a video last week, and that video was basically talking about what the condition is all about. And this the while I was talking about it, I was basically talking about it from my own experience and from my own experience, my own diagnosis, every single thing. But you should know that things happen, people get sicknesses differently. Yeah, let me share for you the first video of this thing. Okay, so I can see that our guest is trying to log in. So very soon he's going to be here. But I've shared the link, and when it's going to soon reflect. So like I was saying, so I had that, and then the first you guys can if you can you can open the live chat and then click on the link. So that was the first video, and then after that, the video that I produced last week, I'm still going to it's about 2 weeks ago, because last week I was unable to put up a video because of a tight schedule. Beyond that, I'm having issues with recording videos, so I couldn't record any other videos. So that's why I'll have a live stream today. And basically, this is like a series. So hold on, guys. I'm trying to listen our guest, but I think he's having connection issues. But nevertheless, I think he's here. So I decided to like for this new episode of today's videos. I mean of the for the new episode of that campaign, I was like, okay, let's just do a live stream. We get a professional to tell us about it, because sometimes it's very good to hear the information from a professional, because they're going to give you more information. Because most of the things that I'm going to talk about are really subjective to me. Do you get? And yet people experience these kinds of things differently. It's the same thing with any other kind of sickness. And that because of that, even things like malaria, people are going to have, and their malaria is going to be very different. Like how they're going to get it is going to be very different from you, or their cold, that kind of thing. So because of that, I was like, okay, I think it's a good idea if we have a professional come here and talk about it. Yeah. So and this person is actually a medical doctor. So I am trying to let me try and find out what the issue is with him joining, because it feels like he has some issues. Hold on. Hi, everybody. Hi, everybody. I'm so happy to see you. I am so damn happy to see you. Hi, Derek. I hope you are doing fine. I am so happy to see you here. It's very good to see you in and join this live stream. Guys, I'm so excited to see you here. I can't say this enough, but I am so damn excited to see you guys here. And Andrew is going to be joining in. I'm trying to make sure that he's able to join in. I think it's his network that kind of has an issue. That's why he's unable to join in very fast. But he'll soon be here because he still has time, about 18 minutes. So like I was saying, I've already shared the links to the previous videos. And okay, I think, oh boy. Anyway, I think he's having a network issue. People, first hold on. I first um Okay, so I think he's going to sort out his network and he'll be here very soon. So guys, thank you for coming to this live stream. Like if you've just come in, I'm just saying that this is like a whole it's a period of me producing sit down videos about venous insufficiency. And it's basically for me to share information to people so that they can get to know about it. And because of that, we need to have someone who is a professional to be able to dissect things very well. So, uh, guys, I am so sorry. He's having an internet issue because I can see him trying to join us right now. But the problem is that as soon as I try to let him in, he gets an issue. Like it just moves off. So it's so hard. But I'll say this again. I'll keep on welcoming you people because I'm so happy. I didn't really expect a lot of people to come in because not every single person is going to log in is going to log on to health related live streams. I mean, like why would they? You get that kind of thing because some people find it very boring. But I'm so happy to see you guys here. I can't say that enough, but thank you so much. Please do share this live stream so that other people can come in and receive the information and be able to also share with other people so that it can be able to people can be able to people can be able to join in and get the information. I'm seeing extra people coming in, guys. I am so happy. I can't say this enough. I am so happy to see you here. Like I didn't expect people to tune in. Just that's just what I just said. Like because not everyone is going to come in like for this kind of videos. But when you see people, you just know that yes, people really wanted to watch it. So guys, I'm so happy to see you here. And I'm trying to guys, Andrew is trying to get in here, but it looks like he's really having an network issue. I'm just hoping that nothing sabotages this live stream because we've really prepared for it and we cannot dare to have it go east, west, and south. But if you're just coming in right now, I'm so happy to see you, and I'm so happy to see you. I can't say that enough. I don't know. But I don't know. You guys can comment in the comment section. How many of you guys know about venous insufficiency? Yeah. Like how many of you guys know what it's about or maybe have a clue or have seen it? Yeah, please do tell me. Yeah. Do tell me, but beyond that, can you guys hear me? Yeah, do tell me if you have heard about if you have heard about venous insufficiency, yeah? Or maybe you've once Googled it, or maybe you've seen someone with it, yeah? Please do tell me. Do open the live stream chat, make a comment, and then we'll get to know, and then we can start off from there while we wait for Andrew to get in, because he has 30 minutes right now. He'll be here in a short while, and it'll be nice if we can have where we can start off from. But I'm kindly asking if any of you guys has heard about anything to do with um anything to do with um venous insufficiency. Yeah. Or maybe if you have had a clue, or have, like, basically, I just want to know. Yeah, I just want to know so that we can even get a better starting of points for all of us. So yeah, it would be a very good idea, a very great thing for us to know. So please do tell us, please do tell us. Andrew will be here. He's telling me he's trying to sort out his network. So basically, he's going to be here very fast, and then we're going to be able to share the knowledge. And this live stream is going to be boom, 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 boom. But don't forget to, what's it called? Do not forget to share. Do not forget to share this live stream, because it will be very good for you to share it. Yeah. So please do join in. So I'm seeing Andrew. I think he is here. He is here, guys. Oh boy. Um, he's still having an issue joining. I just don't know why. I just don't know why. Oh, I'm seeing people joining. Hi, 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 hi. Hi, 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 Glorious. How you doing? How are you doing? I'm so happy to see you. Always stand up for my um you always stand up for my YouTube live streams. I'm so happy to see you. I'm so really happy to see you. And yeah, so I'm trying to solve this issue that Andrew is having, because I'm seeing him trying to join, but he hasn't been able to join. I don't know why. And it keeps on showing that he's unable to connect. I don't know why. But like I was asking, while we wait for him to join, has any of you heard about venous insufficiency, or if you've seen it anywhere? Okay, so oh boy, guys. I don't know what's happening. It feels like internet wants to sabotage us, yeah? It feels like internet wants to sabotage us. I just don't know. I'm starting to get mad at this internet. Okay. Anyway, can you guys hear me? I just hope I'm not speaking to myself. Can you guys hear me? Oh my God. You have not heard about what venous insufficiency is. Oh my goodness. Anyway, the good thing is that we're having this video to basically share information about it. And because of that, you are welcome here. Um, so I think he's finally here. Boy. Oh boy. Okay, thank you so much. I thought you guys cannot see me. I thought you guys cannot hear me. So I needed to confirm before even our guest comes in and everything just starts going berserk. You know how everything can be very funny over here, because I'm seeing him. It's been like over 10 attempts he's trying to get in here, and he's having issues. I don't know why. Okay, so it's a very nice thing that I'm audible, that the light is good. So that means I am ready and set. Yeah, even if I'm already live streaming this, yes. So I'm trying to make sure that Andrew really gets in. I just hope he gets in here, because I don't want to do this thing alone, because this was supposed to be with someone who is a professional, so that they're able to share some more information. Yeah. So I've seen him, so let's see. I think he's going to be joining now. Yeah, guys, he is joining. Oh boy. I'm seeing, okay, I think he'll be able to connect now. This is so sad. Okay, so I'm going to, he's in the waiting room. I just want him to be very stable so that, because I'm overly getting excited about him joining, and then when I'm about to let him in, the so let me let me see. Oh, I think it's an internet thing, guys. These strangers will make you want to run away even when you don't have where to run away to. Yeah, I don't know why. Now my video is lagging. Okay, so guys, while we try to like prepare, um, while we try to prepare, while we try to prepare, while we try to make this thing work, I'm going to try other means of getting Andrew to enter the live stream. Yeah, so just give me a minute. Okay, guys, and thank you for your patience. Andrew is here. I'm so happy, guys. I am so happy. I am so happy. This is finally um okay,
Oh,
guys. Finally, we are here. We are here, and it's. I don't know. I'm so happy. I'm so happy to have you here, and
me too.
I just don't know. I'm so happy to have you here because yeah, we've been in a hustle of trying to get this to work, like of trying to get you in. But I'm so happy
Mhm.
that we're here. So yeah, so I'm trying to change the layout to a better layout. So mhm. So anyway, I'm so happy to have you here. I'm so happy to have you here, Dr. Andrew. I'm so really happy to have you here because it has been
Thank
a
you.
hassle for us to have this like work. You know how internet can be and everything. I'm so happy to see you here, guys. If you do not know Andrew, let him introduce himself. Yeah. Okay.
Yeah. Hello, viewers. My name I'm called
Andrew is going to
Andrew.
introduce himself. And
Yeah,
you
I'm
guys have to go
Andrew.
check out his YouTube channel. He does
Yeah.
very enlightening.
So, guys, I don't know if you can be able to see me. I think Pauline has gotten some internet issues. We are having challenges with our connection here. I don't know if she's still on or I'm the one who is off. But I can see myself on the camera. but I'm not hearing. I'm not hearing Pauline. So let me know, guys, if you are able to see me, and we keep the live going. Oh, Brenda is saying, Andrew, great lighting. The truth is that are you trying to mean that I put good light or what? Because I've just seated here near the window and I'm trying to use the natural light, but the network is very poor.
Guys, can you hear me? Oh, wow. Okay, so 1 minute it's me with an issue. Another one is Andrew having an issue. Oh boy, this is just looking so bad. But nevertheless, the devil shall not succeed. And I'm seeing Andrew is back. So just a minute, he's going to be in the studio. Okay, here we go. I hope everything goes well. I hope we don't have issues again. Gosh, I don't want to cry on this live stream because of internet. Oh my goodness. People, YouTube is a hassle.
Yeah, sure.
Oh, hi, Andrew. I'm sorry, I had internet issue.
Yeah,
Can you hear me?
I'm hearing you now.
Okay, that is great. That is great, guys. We are so sorry for that. For the internet issues. Yeah, you know, when you're in the trenches, anything happens, and yeah. Anyway, so like I already said, those people are just joining in right now, and those who are going to join, we're so happy to host you. And today I'm having Andrew on my channel, and I don't know if this is and please guys, okay, yes. Doctor is back, but for some reason, he's off again. I don't know why.
Are you seeing me now? Oh no, this is horrible.
Um,
Um,
okay, guys.
okay, guys, this is so bad.
Yeah, the
Yeah,
internet is
the
being
internet
a
is
problem,
being
but
a problem, but oh, oh
Andrew,
no.
can you hear me? Andrew, can you hear me? Okay, guys. Firstly, I would really, really like to apologize for this. Like, this was not part of the plan. There weren't supposed to be any kinds of hassles. So, firstly, is that I'm thinking Andrew has a problem now, with the live stream. I don't know why. I honestly don't know why. This live stream was supposed to be very fun. Yeah, but it seems like the devil just wants it to go down. Yeah, so hold on, let me try and reach him, and then we can see what's going to happen next. Because I'm thinking if it's not successful, I'm thinking if it's not successful, um okay, so Dr. Andre is back. Yes, he is
Yeah,
back, and I'm thinking you guys
I
can
can
hear
hear
us,
that.
and I'm going to ask him to reintroduce. Okay, so I'm going to kindly ask you to reintroduce yourself.
Okay, thank you so much. Hello, viewers. My name I'm called Wefwafwa Andrew, and my channel name is Andrew Wefwafwa Medical Videos. I upload the medical videos on my channel where I teach about health, and then I also do some singing, and sometimes I also upload the community outreach videos where I go to the communities and I teach people about common health conditions. Oh, Pauline has gone off.
I'm
This
having
is
a tech
bad.
issue.
Sorry, guys.
No, I'm here.
Okay.
We are so sorry, people. We are so sorry. We are really trying our best to have this work. So
Mm.
I'm hoping that you people can hear me. And Andrew, can you hear me?
Yes, I can hear you clearly.
Okay, so like I was saying before you came, I was telling these people, that today we're going to be talking about, we're going to be talking about, um, venous insufficiency, and I asked people if they have heard about it, seen it, and someone said they've never really heard about it, so they are basically here to learn more about it. So,
Mm.
and like I already told you people that for me, why I said this thing is because I actually suffer from it, and it's really in its worst stage right now. The only good news is that I do not have ulcers. So, the first thing that Dr. Andrew will be talking about today is he's going to basically be telling us what venous insufficiency is. Yeah. So, if like someone already said they've never really heard about it, and so Dr. Andrew is going to be telling us what it is about and what it is
Mm.
from a medical perspective. And guys, I must say, please make sure to share this live stream. People should come get this information, learn about this, so that it's easy for us to share information. Yeah, so Dr. Andrew is going to tell us what venous insufficiency is. Yeah. So yeah, over to you.
Yeah, thank you so much, Pauline. Before I even talk about venous insufficiency, its definition, I know we may not know the definition of venous insufficiency, but at least all of us know that we have a heart. And most people talk about he broke my heart and the other things. So people are well conversant with the heart. Yeah. So the heart that we are going to talk about is not the other one that people usually break and get broken because when it breaks down, of course, you can't be alive. But people always always break their hearts. Anyway, the thing is that we all have a heart, and that heart pumps blood throughout our whole body. But for it to be able to move through our bodies, we have what they call bloody vessels. And we have two types of blood vessels. We have those blood vessels that carry blood away from the heart to the body. Those are called arteries. And then we have those blood vessels that bring blood to the heart back. When it has picked the blood that has been used from the body, it brings it back to the heart such that the heart will be able to pump that blood to the lungs and it gets oxygen, it comes back, and then the arteries carry it to the body for using. Now, as you heard, the thing was venous insufficiency. So the term venous comes from the veins. Like I told you, we have veins and arteries. Arteries carry blood away from the heart, and then veins bring to the heart. So this problem usually occurs in those blood vessels that bring blood to the heart, the ones that we call veins. That's why you hear venous insufficiency. It means its function is not sufficient or it is not enough. It is not working well. That's why they term it venous insufficiency. There is a problem with your veins. So what happens is that in our hearts, we have what they call valves, or we can call them maybe doors for easy understanding. In that when blood is coming down, it's going to the heart, that door or those valves open and then it allows blood to flow in. And then when it has flowed in, when it is flowing through the blood vessel and it goes through the valve opens like I can say it could be like this. Let me assume the blood was coming from in front of me. So your valves are closed like this. So when it comes, it pushes and then it opens. So as it opens, this allows blood to flow through the vein. After it has flown through, the blood that has gone now pushes back and the pressure builds that enables these valves to close like this. So with the venous insufficiency, there is a problem in the vein, but not only on the vein on top, but on the valves to be specific. It is in the vein, but on the valves of the vein. In that those valves, they don't work normally. Like normally after blood entering, it is supposed to close. But here, the valves may close or they may not close well. So that is why there is a problem. That is why they call venous insufficiency. It's a problem in the veins, but on the valves that are in the veins. So there's a problem with the veins. So there is a tendency of blood flowing backwards because, as I told you, it is supposed to close when blood has entered. But here, it is not closing well. So the blood that flowed maybe this side, if these valves are not closing well, there's a tendency of that blood flowing backwards. So when it flows backwards, that is when it goes down to our lower limb. So in simple terms, venous insufficiency is a condition where there is a problem with the veins of your body, but to be specific, the valves, which leads to the backflow of blood. Yeah, that's it. Pauline, can you hear me? I can't hear you. Pauline, I can't hear you. It seems you muted your
Muted so
microphone.
that I don't interrupt. Okay, yes. Can you guys hear me now? Yes, I'm so sorry. I'm so sorry. I tried to speak and it was muted because I muted myself. I didn't want to interrupt. So, you guys, someone had already said that they do not know what venous insufficiency is, and I believe most people don't know or did have an idea. But Dr. Andrew has just simplified it for you guys. And one thing that I must credit you for before I even proceed is that you're such a nice teacher. Do you get like when you speak, everyone gets to understand, and I'm like, wow. Anyway, so you
Thank
guys
you.
have like understood what Yes, so you guys have like understood what venous insufficiency is. So I'm wondering if any of you guys has questions before I proceed to like indulge him in something more for him to enlighten us about before I continue to ask him. If you have any questions, please do drop them in the live stream chat down below in the how they call it in the chat in the what I don't know whatever it is. Please do drop your what's it called your questions. So yes, now I'm going to ask Andrew, Dr. Andrew, what is likely to cause venous insufficiency? Yeah, like what's likely to cause it? What do you think? Is it is it that someone is like does someone have to do anything to get it? Um, the only thing that I know me as me is that pregnant women are like if they don't exercise whatnot when their legs swell they can easily get it. You maybe clarify on that, but what exactly causes this kind of condition? Like what would you say is the cause? What exactly is the cause of this condition? Because that would be very important for us to know and get enlightened. Even me myself, I don't know where mine came from, but I believe maybe has gone with it. I don't know. Maybe you can clarify on that.
Okay. So thank you very much, Pauline. In most cases, you may not have to do much to get venous insufficiency. Most people are born with that problem. in that sometimes if your mother or your relative had a problem of venous insufficiency, that puts you at the risk, and by default that will be a cause. It is a risk, but it is a cause at the same time if we can't identify anything else apart from the family history. So in most cases is family history. People who have had someone in their family with that problem have higher chances of having that problem. But sometimes it is also related to lifestyle, the way we live. Sometimes when we don't eat well, or and we maybe become very fat, and that in a medical term they call it obesity. So if you don't eat well and you get that problem of obesity, or you become very fat, that can put you at the risk of getting venous insufficiency. And another thing you talked about, pregnancy. Yes, pregnancy is also a risk factor. Uh, don't get it wrong. Someone may be out there who is single and may be worried that now if you getting pregnant means me getting problems, then I will not uh, accept to get pregnant. We are just mentioning these things that can put you at risk, or the things that can cause. So pregnancy itself has no problem. There's no problem with you being pregnant, but we are saying that some people who have that problem, they happen also to be pregnant. So pregnancy can also be a cause and a risk factor at the same time. Then we have other people who sit like for a very long time, who sit like for a very long time in one place, or people who are at a risk of standing for a very long time, maybe like throughout the whole day. So you find that those people, there is an increased pressure in their blood vessels, majorly the veins, that causes also uh, venous insufficiency. And then there are some people who have problems with the with blood clots. For example, if you have a blood clot in your thighs and it blocks the vein, the blood that is returning will meet an obstruction, and it will not have an option but to flow back. So that can also cause venous insufficiency, but that one will be what they call acute venous insufficiency. That one may occur for a short time and not a very long period of time. Yeah, so those are some of the common causes of venous insufficiency. However, there are those ones like also when as you grow old, that can also be a cause or a risk factor. So it's like Pauline went off a bit, but I can try to summarize the causes for her and whoever was not getting well. So we say that one cause was old age. As you tend to grow old, the high chances that you may get venous insufficiency. And then we talked about obesity or increased weight that can put you at a risk, or it can also cause venous insufficiency. We also talked about the problem of a blood clot. You may have a blood clot that will block the vein, and that clot will prevent blood from flowing through the vein. As a result, it will result into venous insufficiency. And we talked about also hereditary factors, where you are born, when you are at the risk of getting venous insufficiency. So those are some of the major causes of venous insufficiency.
Okay, thank you very much. I'm hoping that you can hear me because I had an internet glitch, but I had most of what you said. And okay, I don't know. I don't know if for me it's within my like say maybe hereditary because my mom doesn't have it unless she doesn't know. But what I know is that she doesn't have it. I haven't seen anyone who has it in my family, so I'm thinking maybe I was just born with it. I don't know how it happened. But I think
Yes,
because, like you said, you don't have to do a lot to like get it. Most of the times, it's by ways that are beyond our control. Yeah.
yes.
So basically, yeah, I think for me, it's one of those reasons that we're born with and whatnot. But then also, I like to ask before I proceed, I like to ask people I like to ask people to drop their questions. If you have any questions, please do put them in the live chat. Is it? Yes, in the live chat. And Dr. Andrew will be able to respond to them. So the other thing that I would want to ask at this point is that
So,
how does someone get to know if they have
like Pauline, like you say that you don't have someone in mind who may be having venous insufficiency, and that may bother you a bit. But you also have to know that in most cases, venous insufficiency may not present with the same signs like you're having. So sometimes someone will just have it and will have very mild signs and will not complain, and you will not be able to know. And also, given the fact that when we talk about family members, it's not only at home, but also people who are in your clan and others. All those ones contribute to the family. And then also in medicine, there is what we call idiopathic. Sometimes something may come and the cause is not known, and that one is allowed. For example, like I talked about family history, you may be the first one in the family in most cases. So when we talk about family history, it either starts with you sometimes. In most cases, we mean that it has ever existed in the family. But also we have idiopathic, unknown. So it may be that you are the first person and it is starting from you. So sometimes it happens like that. And sometimes, like we said, just about the lifestyle, like sometimes we sit for long hours at work, maybe you do computer work just for a very long time in a day, like morning up to evening. Yeah, it may happen like that. But in most cases, of course, it must have maybe a family background or it may just be unknown. Yeah.
oh, okay. Now that makes me understand now. That makes me understand. That's very good of an explanation. So what I was going to ask is that then how can people tell that they have it? Yeah. Because for me, I was misdiagnosed the first time. It's the second time where I got a proper diagnosis. So people need to know how can they know what should they look out for and for them to be able to go seek medical like attention, like how someone has cough. So the first thing they
Mm,
check is can they cough, can they breathe well, that kind of thing. So what should be the signs and symptoms someone should look out for, so that they're able to go and visit the doctor and get to know what they have or that they have venous insufficiency.
mm. Yeah, so in most cases, we just present with the non-specific signs and symptoms. Like those symptoms may not be specific to venous insufficiency. It means they can occur in any other disease. For example, like feeling tired, like that general body weakness, or just feeling fatigued or feeling tired all the time. It can be a sign, though it is not specific. And then sometimes you may have specific signs like pain in your lower limbs, like your legs. You may feel sometimes pain. Those pains, you may swallow medication, but they don't go. You really try to think about the cause. You check for malaria, you do what? You find that you're really feeling normal. but the pains in your legs are persisting. So that can be also one of the pains. Or sometimes you may, if it has advanced, you may actually have some signs on your legs like engorged veins. When I talk of engorged veins, it means those blood vessels that are swollen. You see, they are protruded, they have come out because there is blood that has occupied there, like too much. So sometimes you can see that. And then when it has complicated, some people can present with ulcers, or I can just call them wounds. I know all people know about wounds and ulcers. We can use those terms interchangeably. Sometimes you may have those chronic ulcers or wounds that don't heal on your legs. You try to put their medication, but they take very long without healing. So they may stay for a very long time. When you see such a sign, you need to think about a blood vessel problem. It may not just be venous insufficiency, but most of the conditions that affect our blood vessels present with that problem also. But the major difference here that it will occur in your legs, not other parts. You will find that it will occur in your lower limbs and those ones will not heal. So those are some of the common signs and symptoms. But there is a saying that goes that diseases don't read books. So you may have some signs and symptoms in books, but they may not be the signs and symptoms the patient is feeling. So someone can present with other signs and symptoms apart from what I've mentioned. So that's the thing.
Okay, so I understand. So okay, just to chip in. Well, for me, my own situation was that I didn't even get ulcers because that's the only thing that makes me a bit different from people whose thing is at the same stage as mine. For me, it's basically my feet would swell. I used to feel so much pain, and then sometimes you feel like there is heat. There's like heat inside, like your flesh. Should I say, like you feel heat inside, but outside your skin when someone touches, they don't even feel any kind of temperature. So my feet would hurt, they would, and not only my feet, my legs, and then they would swell. And by the time I'm in the hospital, that day looked like my feet or my legs would just burst the moment someone just tried to like put there something like a thorn or something that is sharp. So like I think what that doctor is actually saying is true because thing like I already said, like everyone has their own kinds of like whichever symptoms are going to occur to them, and the doctor has just said it. So you people need to watch out for these kinds of things because yeah, you don't even know where that could be or taking you. So that leads me to the next thing that I was going to ask. Yeah,
Mm,
so how then do they diagnose this thing? Like how, like when you go to the hospital, which kinds of tests do
mm,
they run for the person for them to know that this person has venous insufficiency or maybe it's lymphedema or maybe whatever other condition they have? What would they like? How would they run the test? Yeah, because I think that's also very important because sometimes you see you get those signs and then you go to hospital just like me. That's how I was misdiagnosed the first time. They told me I had lymphedema, but I didn't have it. So I had to go to the hospital to do an ultrasound to confirm that if they go to the hospital and they just watch a
mm.
confirmation from it, like the doctor, they know which red lights to look for in case they are they're not sure that this person is doing the right thing.
Okay. So thank you very much for that question. So most cases in all diseases, actually, we will start with taking the history. That means we ask some questions about you and how you live and how you're feeling. And then a medical worker or a health worker will go on to do some general body examination. They will look at your body. They may just press at they may just press at the limb and they just check it clinically. Like just looking at it, you can be able to tell that this must be venous insufficiency. But to confirm, to be very sure that it is not any other thing, because we have other problems like deep vein thrombosis, where there is a clot in your blood vessel, and it can also present with the same signs and symptoms. So to differentiate them, you have to go and do a scan. A scan is that machine, most of you have used it, that abdominal scan, where they look into your abdomen. So here they do a scan on your leg. Where there is that swelling, they can do on your calf, and they look deep into your blood vessels and they see how they appear, if they are engorged or if there is some blood pooling there. That swelling may just be that maybe there is a mass, it is not the blood vessel. So when they do that scan, it helps them to differentiate and know what is causing the sign that you're seeing. And a person with the skills of ultrasound scan will be able to tell us the results that will let us know that that is venous insufficiency. Yes, I can't see you, Pauline. Guys, I'm still waiting for Pauline. I can't switch to the questions because the network was very poor and I just wanted to remain here as we wait for her. But I think that you guys are enjoying this video. As Pauline said, please make sure that you ask questions. As we wait for her, we want to see questions flowing in. We apologize for the poor internet connection, but next time we hope that things will be better. So just remain on. Yeah, I can't really be able to interact with you. Let me try to go through the chat section and see if there are people here. So guys, are you able to hear or see me? Because Pauline is off right now. Pauline is off right now. I can't see her. I don't know if we have someone on right now to talk to me because I can't. Sorry, guys.
So I'm very sorry for that issue. I had an internet blackout, and for some reason I'm not seeing okay, yeah, it's now here. I'm so sorry for that issue. Internet is really being a
Okay.
problem that I'm starting to think that we finish all we want to discuss today, but we would have another one to complete it. But the good thing is that I heard what you said about everything. So by the time I went off, I was saying that you people now know exactly what to look out for. Like, firstly, what the condition is, what signs to look out for when you go to a hospital. You know exactly what the doctors should be doing. You know these things, you're going and you're complaining your legs are hurting, they're now going to start checking your temperature or your head. Yeah, those kinds of things. And I must say this, I really like the way Dr. Andrew is actually explaining everything. Like, it just simplifies everything. And you know, there's some people who will be talking and you're like, oh boy, what are these people talking about? But I'm so happy that people are like myself. I'm not even lying, by the way. I'm telling the truth. You know, you go to a medical officer or a doctor, basically a doctor, and the person will be talking and you're like, what is this person talking about? I'm not even understanding what I'm sick of. But it's a good thing that you actually have that special gift of being able to explain to people and they understand, because personally I'm understanding very many things. Yeah. So, like I already said, he has already given you people what to look out for, like when you're not feeling fine, what symptoms to look out for. And if you go to the hospital, you know what to look out for, you know what the doctor should do, or at least he has given you the tips of they should be able to perform a scan. Don't go and you're complaining that your legs are hurting and the person is trying to put a stethoscope on your head. Do you get? Anyway, so what I wanted to ask now is that there are two questions. The first question is that, so after you've been diagnosed, what is the treatment? Yeah, what is the treatment? Because this thing doesn't look like it's easy for anyone. Yeah, it's not easy
Mm.
because this is some blood circulation and everything. So what then is like the solution for what's the solution when they find that some you have venous insufficiency?
Okay. So in most cases, there is what they call like supportive management or just the management that helps to relieve the signs and symptoms that you're feeling. For example, if you have it, but you are not having any problem of pains or what, and it is not causing you any discomfort, they can do what they call watchful waiting. So they wait as they watch you, as they observe you like closely. They may not put you on any medication if it's not serious. Then another thing, if you're having pains, of course they can give you some painkillers, but that works majorly for acute, because the chronic one you can't keep swallowing painkillers for long. And then there is what they call the compression stockings. Are those stockings that you put on? They are a bit long. They are not like our ordinary socks you put on and they are able to reach up to the thighs. So when you put on those socks, they are able to compress. That's why they are called compression stockings. They are able to compress or to press the blood vessels such that that helps to keep your blood within the blood vessels, and it also increases the pressure in the blood vessels that will together help to push blood through the blood vessel such that it doesn't uh, go through and then it causes the engorgement, or it penetrates and it enters into your tissues. So those socks are very important, but when it persists, there are also other procedures that they perform on you, but they are surgical. Personally, I've never seen it when it is being performed, and I've never performed one because I'm a medical clinical officer. We don't do those complicated surgeries. They are not all complicated, but they are not allowed. But how it is done, I am aware how it is done. So what happens is that they can inject some chemicals in your blood vessel that is affected or that has the problem of insufficiency, and that chemical passes through the blood vessel and it destroys it. So when it destroys it, the body has a mechanism of diverting the blood into another blood vessel that is normal. So they can put their chemicals, or they can just hit it, or they can just block it. Yes, they cut it off and then they tie it. So that is what happens whenever they do that. The blood will always find another blood vessel. There is a compensatory mechanism that the body does, and it comes up with a new blood vessel that will be able to supply blood to your body part. Yeah, so those are some of the things that can be performed as per now. I know in advanced countries there may be other technologies that they use, but for what we have here in Africa, those are some of the procedures that can be performed, though they can be performed in expensive hospitals. So the most common method of treatment here is that compression with those stockings, and then they can also tell you some exercises that can help you, like to reduce your body weight, and also of course you can use your diet to help to improve your body weight, to put it in a shape that is uh, able to be handled by the body. And then also they can just tell you to change maybe your lifestyle. If you sit a lot, they tell you to be moving sometimes, to be balancing, not just standing for long and without sitting. Hello, Pauline. I don't know if everyone has been getting
Okay,
me.
can you hear me?
Yeah, me, I can hear you very well.
Can you hear me?
Yes, I can hear you clearly. Like clearly. I'm hearing you.
Okay, just to confirm, can you hear me?
Yes, I can hear you.
You can hear me?
Yes.
Hello, can you hear me?
Yes, I am hearing you very well.
Can you hear me?
Yeah.
I'm wondering if okay, so okay, okay, I'm so sorry. I have to keep on apologizing because my internet is not that best right now. Thing that you can hear and okay, okay, so what I wanted to say is that can you hear me?
Yeah, I can hear you. Sorry, guys. I don't know if you are able to see me, but internet is disturbing. I don't know on my side. Sorry, guys. Hello, hello, hello. Is anyone hearing me? Sorry, guys. Oh, I don't know if people are able to hear me. I can't see people in the chat section here. Hmm. Pauline, I'm
Um,
seeing you.
hello,
Yeah, I can see you.
hello.
Hello, I can see you. I can see
Can you
you.
hear me?
Yeah, I can hear you. I'm hearing you.
Okay, okay. So, what I wanted to say is that, like from what you explained to people about compression socks. Yes, can you hear
Mm.
me?
Yes,
Can you hear me?
yes, yes, I'm hearing you.
Can you hear me?
Yes,
Can you guys
I'm
hear me?
hearing. I'm hearing you
Can
very
you hear
well.
me? Okay, so what I was going to say is that you talked about compression socks as something that they would give the people to wear so that their veins are made to push blood.
Mm.
Yeah, so you talked about compression socks, and I found it as like, okay, I think people need to know what exactly compression socks are. So I decided to bring a sample. Yeah. When my internet
Mm.
became glitchy, I went and picked a sample of what compression socks are. So I decided to bring a sample of what compression socks are.
Mm. Guys, I hope you are able to see me. Pauline has gone off a bit. I think network is disturbing. But if you're there, kindly let me know that we are together. I don't know if there is someone still there. I stopped seeing comments long time ago. I'm not seeing them. Is it my phone just or I need to see you guys? I need to see you. Yes, I need to see you and we continue with the chat. I need to see you.